This segment of Delmarva Life is brought to you by Peninsula Home Care.
Well, you know, there's more than one way to control pain following surgery. The most common way is with pain medication, but not everyone can take it.
Electrical stimulation is another method, and tell us more about it from Peninsula Home Care, Kay Satchel, who is the director of the Ocean Pines branch, as well as David Barnes, Peninsula Home Care physical therapist. Thank you guys for coming in this afternoon. Appreciate it. Now, you brought a little toy here, and this is called an E-stim device. What is that?
It's electrical stimulation unit. It actually transmits waves to the muscle, hundreds of waves a minute, and it helps relax the muscle. It helps stimulate the muscle. It brings blood flow to the muscle. Relieves pain, a lot of uses.
Yeah, because we mentioned pain relief, but it also helps with other things to retrain the muscle and things like that. And it's so simple, David. You're actually going to hook Jimmy up.
I'm going to hook
right
Jimmy
here,
up.
right now. Yes, he is.
We talked about this? No.
And just tell us what you're doing here.
The first thing we want to do is make the patient comfortable. So if there's any part of the treatment that you don't like, you can stop at any time by pushing that red button.
And this just shuts off the unit?
That will shut the unit off.
Okay.
We got a positive and a negative electrode.
Okay.
And if you had some type of thumb injury that was keeping you from functioning,
right.
Zipping your zipper, buttoning your button,
right.
A PT and OT would also be treating you.
Okay.
One of the ways that we would have to get at the pain or the dysfunction would be electro. So what you're going to feel is you're going to feel a slight pulse here.
Okay.
And we're going to start you, and you can just let me know when you start to feel the
So we're not starting out at 220 here, right?
No, we're not starting out at 220, and it's not meant to be painful.
Now, what is the intended effect of this? What is it supposed to do?
Well, what we're going to do with this treatment is we're going to actually get your thumb muscle to start functioning.
Okay.
And you'll actually be able to see your thumb start pulsing.
Okay, yeah.
I can see your fingers actually moving around.
So if you had a stroke or if you'd had a radial nerve injury and you were unable to use your thumb, your mind could not actually communicate with your hand to get the function, we would do a treatment like this, which would run for about 10 or 15 minutes.
Right.
And you would start getting the function back in that muscle.
That's amazing. And you're not moving it, Jenny?
No, I'm not.
No, that's not.
It's completely electrical stimulation.
Wow.
And the upper extremity is different than the lower extremity, so we have different settings, whether it's the knee or the ankle or the hand. So this is actually a upper extremity triphasic.
Oh. Now you can also you've used these for pain relief?
Yes, I've had wonderful results with pain. I've had patients that were actually on methadone that I treated with this unit. It was so effective that we got a portable unit. I had one lady that went to pony pinning in Chincoteague. She put it on her knee and put an ace bandage around it and spent the whole day in Chincoteague and never went back on methadone.
Wow,
how about that? Now, Kay, you've had personal experience with this.
I have. I had some knee surgery a couple years ago, and of course, you know, you're not home very long. I was at home about a week and then went to outpatient therapy. And after the first physical therapy treatment, my knee kind of went, whoa, what have you done to me? And my therapist actually used the E-stim to relax my muscle and help with the pain so that I was able to continue my exercising and get better as quickly as possible.
How about that?
Now, this is a portable device, and you're obviously trained to use it as PTs are, but people can use these in their homes?
Yes, once we've determined the need and we find out what's really working for the patient, we can get doctor's orders, and often Medicare pays for a small unit for patients to use at home. You know, in the long run, if it cuts down on the use of pain medicines, it's a cost savings in the long run for Medicare and great adjunct for the patient for their other therapies.
Now, this is not a replacement.
No, this is not a replacement for therapy. There's no easy way to get out of physical therapy. This is just an adjunct that we have to it. That you just can't hook yourself up and do 10 minutes a day and forget therapy. It's just it's one of the tools that we have that's made my life really easy.
Yeah. So how's it making your life, Jimmy? How does that feel?
I think the next time I have to hitch a ride, I'm going to be golden.
You're going to be golden. You'll be giving thumbs up all day today, aren't you?
People are going to say, "You want to ride?" No, I'm sorry. Just, but this is safe. It's not.
This is safe. You can't hurt yourself with this unit. Everything's got to cut off. If it became uncomfortable for you, you could cut it off, but it could do no long-term damage with this.
But thank you for not letting Lisa get to it. I just wanted to express my appreciation for that.
I was going to let her dial you up.
I don't think so. No. Thank you guys so much for joining us this afternoon to show us this. It's a fascinating piece of technology.
Yeah, a lot of information. Thank you.
Thank you.
With strawberries in season, we have been talking a lot about events surrounding the sweet fruit.
And today we're in the kitchen with the strawberries making strawberry pie. Plus, we're going to hear about a sweet event coming up this weekend, and you don't want to miss it. Delmarva Life at its best here on Delmarva.